If it continues to flare up for you and it kind of built it up, then you probably need to pace yourself from that aspect. That your body tell you it doesn't like that. That's what your body is telling you. It's a little inflammatory response. That's your body telling you to pause and stop. So you had a flare up. What happens now? What should you do? Should you continue? Should you stop? Hi, I'm Dr. Lin with Empowerment Physical Therapy, and today I want to talk to you a little bit about what a flare-up does and what you should do it thereafter if you have a flare-up. So to kind of bring you back and give you some context, I've had the pleasure of coaching one of my high school guidance counselors who I still play basketball with. Middle school guidance counselor who I still play basketball with, and he was having back issues, and I had a chance to kind of coach him through some of the stuff that he should do, and he kind of did those things, and on one of the days that he came back to play basketball, he had said that I had a little flare up. What should I do? Should I continue with the stuff that I've been working on? Should I stop? I said, it's normal. A flare-up is pretty normal. Now, there's an extent to which a flare-up is abnormal. There was a little flare-up. He had a back issue. He did some of the things that he did. But a flare-up is okay. He had a minor flare-up. It wasn't a major flare-up where he had a setback. So it kind of startled him a little bit, which is rightfully so for someone who doesn't understand that is what that means. Your body is you either did something that your body isn't used to, and I think for him it was because when he bought a standing desk, said that he was standing up longer than he typically would. So that might have been the reason that he had a little bit of flare up, because he was now standing a little bit longer than he typically does. And that's normal. That's what the transition period feels like, that your body is trying to adjust to this new stand-up behavior that you're having, where you're used to sitting and now you're standing for an extended period of time. So your body has to adjust those things. So it's pretty normal. So you just kind of observe that, do the things, reset your system, do the things that you would do that worked to calm your system down, and then start doing the things that you normally resume that. Observe that. It's an observation. It's okay. There's nothing wrong with that. Don't stop entirely, but at the same time, pause and observe and see what it does in the next couple of days. So you can see if you continue to do this thing, whether it's sitting or standing or walking for an extended period of time, if it continues to flare up for you and it kind of built it up, then you probably need to pace yourself from that aspect. That your body tell you it doesn't like that thing. That's what your body is doing to you, telling you. It's a little inflammatory response. That's your body telling you to pause and stop. It's like the engine light coming on, kind of blinking in the car, telling you, hey, take a look at me, see what's going on. Something's up, because it doesn't like the way you're moving right now. So you probably need to be evaluated and see what's causing that inflammation. What's causing that flare-up? Is it the excessive standing? Or are you doing things that you're not supposed to do and you did more of it than you should? Did you not pace yourself the way we had asked you to, where you could take a break in between before you get back to doing the things you used to? One of the disconnects that a lot of patients have during the recovery process is the fact that it's the disconnect that they have to pace themselves, because they're probably used to doing things for an extended period of time and not feeling it. Now, all of a sudden, you're asking them to do, they're probably used to doing the same thing, and now it's flaring up their system. And you're asking them to kind of slow down a little bit, to build in rest in between. That's what's required. So kind of stepping back and pacing yourself might help with the flare-ups, so that you don't flare it up too much, but still be able to do the stuff you need to do to go about your day. Because that's real. That's more realistic. It'd be unreal for us to ask you not to do that thing. We don't encourage you to stop life. We just ask that you pace life a little bit, so you could still get the stuff done, but with rest in between. And that rest, you'll have to determine at what point is appropriate for you to rest, take a break, and then get back.